Welcome back. Now, service delivery in South Africa. It seems that protests over lack of services erupt daily in the country. But at the moment, Komani in the Eastern Cape is shut down. Local government bears most of the blame. And now trade union Nehawu is stepping in to help. It's launching a public service delivery campaign. So let's find out more from Nehawu's president, Mike Shingange, who joins us via Zoom this morning. Mike, thank you so much for your time and good morning to you. What inspired this campaign?
Good morning to Mel and your viewers. What inspired our campaign is our quest as a transformative union to ensure that our people receive quality public service. You will know that we are organizing in the state institutions in terms of home affairs, in terms of health, in terms of justice, in terms of SASA, all those departments. That's where majority of our people receive their service. And you and me will agree about the state of the institutions, infrastructure in particular, that is dilapidated. We will agree in terms of the long queues that we will find in hospitals, that you will find in Justice Department and Home Affairs and SASA. And the public do not know what goes behind those walls. The public don't know the number of staff that are required in order for the institution to be fit for people to deliver quality services. All they know is that they are receiving very poor services from these public servants. Now, we have launched this program some years ago, which bore fruits at some point because, for instance, in health, it came with something called National Health Insurance. But we think that they were reneged. The advent of outsourcing and privatization of some key services in hospitals and in education have led to the poor quality of service that is there. Now, we are protesting today as a way of launching in Eastern Cape and Gauteng. We have spent the past 2 weeks engaging various institutions, management, to find out the condition under which our members are working, which is what we're protesting to highlight today. But later today, we'll be engaging with the management, the leadership, the MECs and the ministers and the HODs, and taking them through about our findings in the public service institutions. So that's part of our program. That's going to be ongoing for the whole of this year.
Right. And what are some of the demands that you're actually staging here?
Firstly, fix the infrastructure. You have institutions where workers have to go and go to the shops in order for them to help themselves because there are no toilets that are working. Make sure that equipment and the working tools are available. If it is in hospitals, make sure that there's availability of medication. And secondly, make sure that there's enough staff. The population of South Africa is forever growing and the headcount of public service forever going down. And therefore, we find ourselves fatigued. Therefore, public is not receiving a proper quality services. Make sure that there's management teams that are in place in all the institutions so that management can take place effectively. Not at the moment wherein you say that there's a high lot of people who are acting in management positions or actually those positions are empty. So therefore, there's no management, there's no leadership in that. We must make sure that there's those management, but also make sure that incentivize those hardworking frontline workers properly so that they can be motivated to service our people.
Yeah, Mike, we hadn't spoken about the State of the Nation address, you and I, but I'm keen to get your reaction with regards to the President's speech, particularly regarding the healthcare sector. Various critics saying he didn't spend enough time addressing some of the challenges by the healthcare sector and also providing strategic solutions such as the shortage of nurses, doctors being deployed. You're talking now about the deplorable conditions with which our frontline workers find themselves in these hospitals. What did you make of SONA in the President's address, particularly when it comes to healthcare?
It was disappointing that 20 years later, since government started playing with the idea of introducing a universal provision of healthcare service, which is NHI, to date, particularly in the SONA, very little was said about the much urgently needed implementation of that bill. And that will include fixing the things we are raising here, the issue of human resource, the issues of employing nurses. I'm sure you will remember that just 2 weeks ago, we were marching with the doctors, that they were demanding that they are qualified, unemployed doctors who have spent time in school, spent time doing interns, spent time doing community services. After that, they don't get employed. At a time when majority, 80% of our people are relying on the public health system. But our government continues to fund the private healthcare system. This is unsustainable. So it was very disappointing that there was nothing much that was talked about the availability of medications. We go to depots, we go to hospitals. Patients have been turned away without the medication they're looking for. The queues that you see is because there are no clerks, there are not enough nurses, there are no porters. The hospitals are dirty because we are not employing cleaners now. Every time someone goes on pension or someone perish, the posts are being closed. They are not being filled. And as a result, the headcount is going down every time there's a natural attrition or there's an exit in the public service. That's why we're saying the headcount is going down, and therefore it's decapacitating the capacity of the state to service our people, and it makes a mockery of a dream of the government of building a capable and a developmental state. There's no way you're going to have a developmental state with a dilapidated infrastructure. In fact, most of these buildings are actually not complying with the OHS. That's why you can go to SARS, you'll find workers working in a community hall. That is not complying. If there were to be a fire there, workers will die. Clients will die. You go to hospitals, there are no elevators working, there's no ventilation. We are here in Eastern Cape, the things we are seeing here at Ibolica, where there's no ventilation. One doctor, by 11 o'clock yesterday, have already seen 23 patients. Just by 11 o'clock, the queues were still unbearable outside. But public don't know this. When they look at these nurses, they look at these doctors, as the president will have said in January, that he wants to employ more professional people because the current public servants are fools. That's what he's saying. You see MECs all over the place, grandstanding on TV, humiliating the hard-working public servants there on TV or on Facebook Live. But public don't know what goes on the day of that worker who has not gone for a single tea break the whole day.
We'll leave it there, and I appreciate you bringing this to the fore. Mike Shingange, Nehawu president, of course, informing us more about a campaign they have launched. They will be launching from today, Gauteng and Eastern Cape. They are in the Eastern Cape at this point, but further reiterating the conditions that public hospitals particularly find themselves in, community members obviously bearing the brunt, and saying something needs to be done. Obviously, at the back of the president's Sona address, quite disappointed, Mike says, that a lot wasn't addressed, and also the solutions expected from the president to address issues and challenges within the healthcare sector. We'll leave